I must start with a declaration of interest. As some of you may know, I have advanced prostate cancer, and I'm in a high-risk group for recurrence. I'm currently in remission, I'm happy to say, but I don't know for how long. Now, prostate cancer typically spreads, that's backwards, which is the other way. Yeah, prostate cancer typically spreads to the bones. We don't really know why, and you can see here, that's the spine, that is cancer there, destroying the bone and growing into the spinal canal, and you see it diagrammatically there. I must have operated upon hundreds of men over the years who are becoming paralysed from prostate cancer, secondarism of the spine. So I am what you could call an informed consumer. Now, surgery only postpones paralysis in most cases. Most of my patients would eventually have died, bedbound, paralysed and doubly incontinent. So this very probably, although not inevitably, will be my fate. Metastatic disease in the bones is also very painful. The possibility of pain, in fact, does not trouble me that much. It can be treated, although the side effects of opiates can be very unpleasant and is not necessarily, by no means, a perfect solution. But it is the prospect of a loss of autonomy and dignity that I fear, and that I resent if it is inflicted on me by doctors who claim to have the best interests of patients at heart. Studies of patients who opt for assisted dying in jurisdictions where it is legal show that this fear of mine of losing control at the end of my life is by far the commonest reason for requesting assisted dying. But that having been said, my experience as a doctor had made me an ardent supporter of assisted dying long before I myself was diagnosed with cancer. You learned fairly early on in your studies as a medical student that the practice of medicine is all about evidence. And you may learn some history of how modern medicine in the middle of the 19th century, with figures such as Pasteur and Virchow, and how their work was all about scientific evidence and rejecting the expert opinion of ancient authorities, Galen, Aristotle, and people like that. There were also some early pioneers such as Semmelweis, who showed that infections in hospitals were reduced by hand washing, and yet whose work was rejected by his conservative medical colleagues who were unable to abandon their expert opinion that diseases were spread by smells and foul air, the so-called miasmatic theory of illness. You learn as a medical student that medical evidence is now categorized into various categories. There are various different schemes, but what they all have in common is at the top of the pyramid you have what's called category 1 evidence, where you make your decisions on the basis of randomized, blinded, controlled trials. Clearly not something we do with assisted dying. But at the bottom of the pyramid is expert opinion, which really means no evidence at all. It's just the opinion of an individual doctor. What is so striking to me as a doctor about the opponents to assisted dying is that they produce no evidence whatsoever to justify their arguments. You might reply, quoting Bertrand Russell, if you produce no evidence in support of your argument, I don't need to produce any evidence to disagree with you. But what is so important to understand is there is now plenty of evidence about how assisted dying works in practice, as it has been legalised in so many countries. As John Maynard Keynes is alleged to have said, when the facts change, I change my mind. What do you do, sir? But of course, AD's opponents will not change their minds, as their seemingly pragmatic arguments against assisted dying are really a smokescreen to hide their objection to all forms of assisted dying as a matter of principle. I'm not going to spend time going over the arguments in favour of assisted dying, but would make the following 2 points. Firstly, there is what the lawyers call an a priori case for it. Suicide is not against the law, so you must produce good reasons as to why it should be illegal to help somebody to do something that is not illegal. Secondly, there is also plenty of evidence that there is an unmet need for assisted dying in this country, despite good palliative care. You only have to read the small book of deeply distressing stories, Last Rites, published by Dignity in Dying, to appreciate this. I know from my own experience as a doctor that dying can, for a small number of people, be a most unpleasant experience despite good palliative care. And I know at least 2 palliative care doctors who are of the same opinion. There may well be more, but the implacable opposition of the UK's Association for Palliative Medicine might well make it difficult for palliative care doctors to express any support for assisted dying. There is talk of career suicide. It is curious that in the jurisdictions where assisted dying is legal, it seems that most palliative care doctors have no problem with it. And in none of these countries has there been any move to reverse the legislation, which suggests it is working well. But I want to concentrate on arguments against assisted dying, and I've listed them here. Firstly, suicide is often the product of mental illness. It requires treatment, not assistance. Patients asking for assisted dying will be depressed and should be treated for this and not helped to die. Furthermore, safeguards will fail to identify the depression, so people will die prematurely. Secondly, although a request for assisted dying may be rationally made, and a doctor might rationally agree to it, emotions are more important than reason and located in the brain's limbic system. This is not a joke. I'm quoting a piece written by no less than a former president of the Royal College of GPs in the British Medical Journal. Assisted dying, thirdly, will be abused. Vulnerable people, for which I think is meant the elderly and the disabled, will be coerced into killing themselves, either by greedy or cruel relatives or by unfeeling healthcare staff. A version of this argument is to ask, how certain must you be that abuse will not occur before assisted dying is legalised? How can you be certain? How can you be sure that mistakes will not be made when applying safeguards? Fourthly, a society which legalises assisted dying will be sanctioning neglect of vulnerable people. AD is a slippery slope to inhumanity. AD will become a cheap substitute for providing proper palliative health care. Fifthly, there is no need for assisted dying if good palliative care is universally available. Sixthly, many people with terminal illness might want assisted dying at first, but then change their mind, and then it's too late. An argument, seventhly, raised by an MP in the House of Commons debate a few years ago, she claimed that drugs used for assisted dying are, quotes, barbaric and can cause great suffering. And then 8, right to die will become duty to die. Nifty little soundbite we often hear. The availability of assisted dying will make people feel a burden, so they'll opt to kill themselves if it is made too easy and comfortable. And lastly, you can never predict with certainty if somebody has less than 6 months to live with relevance to the 6-month prognosis criterion. I will do these various arguments in turn. I'll leave them up on the screen so you can see them as I go through them. Apart from points 1 and 2, the other arguments are all predictions and therefore a question of evidence. The opponents to assisted dying rely mainly on their own expert opinion, the weakest form of medical evidence, as I said earlier, and occasionally dubious cherry-picking interpretations from the evidence. We can invoke real evidence, category 3 evidence, non-experimental studies of what has been published in countries which have legalised assisted dying in one of its various forms. So firstly, there is all the difference between suicide in an otherwise healthy individual and in a patient with a terminal disease or intractable suffering from a chronic illness. Likewise, there is all the difference, as Sir Stephen Sedley pointed out in last year's Doran Lecture, between assisting suicide and positively encouraging it. The English law has no difficulty in legislating against coercive behaviour in other areas of life. I don't want to waste time on definitions, but for these reasons the phrase assisted dying is to be preferred to assisted suicide. And I must state again and again, but assisted dying is all about mental capacity and patient choice. It is not about licensing doctors to kill patients. Nor will assisted dying solve the problem of dementia, which characterises modern life, except in the minority of cases where it can be diagnosed at an early stage where mental capacity is still preserved. The law in England currently allows us to refuse life-saving treatment. Think of Jehovah's Witnesses. I operated on several witnesses and they signed a form saying, I want you to let me bleed to death if I need a blood transfusion during the operation. It's perfectly legal. If I gave a blood transfusion to that patient I'd be breaking the law if I saved his life. That is the English law. We allow patients to prefer, as I did, bleed to death, and the refusal is on the weirdest, bizarre grounds that very few people would accept or understand. There is no evidence that vulnerable people are currently being coerced into declining treatment in order to clear hospital beds. Why should it be any different with assisted dying? The opponents produce no evidence that coercion is occurring at the moment, that vulnerable people are being forced to accept they will not receive life-saving treatment. We trust healthcare staff now. Why will this change if assisted dying is legalised? I accept that assisted dying for chronic depression, and this is an argument many people raise, as is permitted in the Netherlands, raises difficulties. But this is a problem to be resolved with suitable safeguards. It is deeply discriminatory to withhold a dignified and peaceful death from people who are suffering intractably on the grounds there might be some difficulties deciding whether to allow assisted dying for the much smaller number of people with severe depression. And is it really so difficult for safeguarding experts to diagnose depression? Besides, you can easily draft legislation to forbid assisted dying on the grounds of psychiatric illness alone, if you wish. Say the opponents, permitting AD will be a slippery slope to killing off depressed patients. To which I would reply, where is the evidence that this is happening in countries that permit assisted dying? In the Netherlands, which is probably a bit of a cultural outlier in many respects, we know the Dutch, they have an openness and a directness, an in-your-faceness, which us English people find really quite disconcerting. In 2017, out of 6,585 assisted deaths, 83 were on the grounds of purely psychiatric suffering, a very small number. Most countries do not permit assisted dying on the grounds of purely psychiatric suffering, and there is no evidence of slipping. I accept this is a difficult area, but therefore it should be examined and discussed, and not used without any discussion and examination of the evidence to justify banning all assisted dying as a whole. Second point. This argument that emotion should override reason is simply absurd and betrays a certain desperation. Collectors of neurobabble will like the reference to the limbic system. Reasoning is located in my frontal lobes. So what? Ridiculous. The same person who wrote that was the one who said that assisted dying made her think of Dr. Mengele and Harold Shipman. Thirdly, there is no evidence, other than one or two rather dubious anecdotes from the Netherlands, of assisted dying being abused where it is legal. Besides, every time I operated, there was a real risk I would do more harm than good. I mean, neurosurgery, this is a real problem. Every operation has a real death risk, let alone damage risk. Medicine is never certain. There is always risk. Did we ban the AstraZeneca vaccine because a few poor people suffered serious cortical venous thromboses? The question is, it's a utilitarian one. Will more people benefit than will suffer? We can never be certain. To suggest that there's some uncertainty about assisted dying is not an argument against it. The question is how many more people will benefit. Fourthly, there is no evidence in countries that have legalised assisted dying that this is leading to the neglect or abuse of vulnerable people. Indeed, the statistics available show that most people opting for assisted dying are not in a vulnerable category and have had access to good quality palliative health care. Besides, even if, and it's a big if, some people are wrongly hastened to a premature death by legalising assisted dying, there is clear evidence a significant number of people in this country are experiencing unnecessarily distressing deaths. We all know that. For instance, as Trevor mentioned, the ONS report published last week shows that the suicide rate for people with what they call non-survivable cancers is 2.6 times higher than for matched control groups. And the evidence is clear from countries such as Belgium or in Oregon and the US that most people opting for it have received palliative care, as I said before. In short, the hypothetical risk of unjustified premature death to so-called vulnerable people is given greater importance by the opponents to assisted dying and prioritised over the real, as opposed to hypothetical, numbers of people who are dying badly at the moment in our country, which is both cruel and discriminatory. Fifth point. Likewise, in countries that have assisted dying, palliative care has not suffered. Indeed, in some, such as the Netherlands, is generally accepted, palliative care has markedly improved over the years in which assisted dying has been available. There is no contradiction between palliative care and assisted dying. Sixth point, people granted assisted dying might have changed their minds. Well, this isn't an argument against assisted dying, simply against permitting it on immediate demand, which safeguards invariably present. In Canada, for instance, people asking for assisted dying on the grounds of intractable suffering must receive palliative care and counselling, mandated, and repeat their request after 90 days. The seventh point is that the lie is completely untrue. It's rubbish. I don't know how the MP saying that got that into her head. Right to die will become duty to die. Really? People who are made to feel such a burden that they'll want to die. Is there any evidence that this is happening? Where are the queues of vulnerable people demanding to die because they feel a burden? Besides, as my wife, who's a very clever anthropologist and writer, pointed out to me, there is a sinister and dictatorial message here, which is the response. The right to die will become duty to die. No right to die means duty to suffer. And you need to rub this in the face of the opponents to assisted dying. If I am to suffer as I die, which is quite likely, I would like some good evidence to know that this will benefit somebody. And if you'll excuse a puff for my next book, which, as Trevor kindly said, is coming out, called Not Inappropriately and Finally, it's not just about dying, but it's partly about a doctor becoming a patient, about my family, all sorts of things, and a certain amount of science. Coming out in September, Jonathan Cape, my publisher, is very enthusiastic. Excuse the puff. And I wrote this, it's a quote. I find the burden argument rather strange. I love my family, and therefore do not want to be a burden to them. They love me in return, and probably would want to care for me more than I want them to. But nor do they want me to suffer, and I do not want them to be left with sad and painful memories of a drawn-out and wretched death. I think not wanting to be a burden is something to be respected and admired on the whole, rather than seen as a terrible criticism of society and families for not caring for people they love. The ninth point, well, it's true to an extent. You can never predict with absolute certainty until somebody is almost breathing their last. You know, cynical junior doctors, the O sign, which means you're 24 hours away from death, and then the Q sign, when the tongue falls out of the mouth and the death rattle. It's not relevant to MD because we all believe that a 6-month rule is discriminatory against people who cannot, who are suffering terribly, but aren't going to die necessarily within 6 months. And then none of this is to discuss the absurdities of the present situation with regard to what's called terminal sedation. That is, if somebody is suffering so greatly in their final illness that they're given such high doses of opiates that they spend the last few days or hours of their life effectively unconscious. The treatment will probably bring their suffering will probably bring their death forward as opiates depress respiration. Now, this is permitted by law on the grounds that the intention is to reduce suffering, even though it will probably hasten the patient's end as a sort of side effect. Now, my friends in palliative care assure me that terminal sedation is very rarely used nowadays. And if it is used, it is only after discussion with both the patient and the family. This certainly wasn't the case when I was a junior doctor 40 years ago, and things were, in a sense, more humane, but at the same time wrong and more open to abuse. But the point is that the patient is allowed to choose terminal sedation. The patient is allowed to choose to be rendered unconscious, to get rid of the pain and distress. So they're choosing to hasten their death. And this is acceptable in both law and practice. In which case, why can't the patient and family choose a quick death, in other words, assisted dying, rather than a slow one? And I don't know what the answer to that is. Well, the answer is the opponents of assisted dying will say, but this choice will open the floodgates to abuse. But then I would reply in turn, why isn't that abuse already happening? Why aren't vulnerable people being coerced into refusing further treatment or being coerced into having terminal sedation? The answer, of course, is they're being looked after by caring healthcare professionals. I simply cannot see why legalising assisted dying will change this. Why will suddenly, as doctors, all be turned into Harold Shipmans? And where is the evidence from countries which have legalised this? but it is happening. And why have so many countries in recent years voted in favour of it? Are we supposed to think that they've not carefully looked at the evidence and weighed the pros and cons? So in conclusion, I think the opponents to assisted dying, I've yet to meet one, by the way. I'm talking about assisted dying all the time to family and friends, and everybody agrees with me, rather like, not surprisingly. So the opponents of assisted dying really have to answer two fundamental questions. Firstly, what safeguards will be acceptable to you to permit assisted dying in certain cases? And the answer, of course, will come none. In other words, they object to assisted dying as a matter of principle and not on the basis of evidence, despite their pseudo-practical, pseudo-pragmatic arguments. And a very good example of this is a piece written by Professor Katherine Sleeman, who's a professor of palliative care at King's College in London. I think this is in the BMJ as far as I can remember. She has written how she has examined the cases of 3 people who went to Dignitas. She says she accepts it was appropriate in their cases, but then states, without providing any evidence whatsoever, that the UK is not ready for assisted dying. This is very strange if you think about it. Does this mean she thinks the safeguards in Switzerland are adequate? If so, why can't they be used in the UK? Or does she think there is some dreadful moral flaw in English society? I really think she should tell us. And secondly, where is the evidence in countries where assisted dying is legal that is leading to abuse? And if there is no evidence, where is the evidence abuse is being missed or deliberately hidden? And the opponents really have no, as far as I can see, have no answer to those two questions. There are many ways of delivering assisted dying, of dying with dignity. What is clearly required in England, and what MD is campaigning for, is an official inquiry where all these issues can be discussed. It's very striking that the opponents to assisted dying in this country are strongly opposed to an inquiry. One can only wonder why. As for myself, I'm not happy about having cancer, but in my more rational and sardonic moments, I see it as vaccination against the dementia and decrepitude, which ultimately I fear more than mere death, especially on behalf of my family, who would have to watch my sad decline, just as I had to do with my own father, a very eminent human rights lawyer, who died at 96, utterly demented. Death is necessary. I struggled with that simple truth. But I'd find it much easier to accept that truth if I knew that humane and kind assisted dying will be available to me in my final illness, if that is what I want. Thank you very much.